We did have an M&M like 3 years ago where somebody was on a beta blocker and a calcium channel blocker, and it was no bueno.
It's
Safe.
definitely safe, but you have to be careful. I will tell you what happens in your electronic medical records when you start to put them in there. You get these huge warnings, contraindicated. And I look and I say, contraindicated? What are you talking about? And it's because they're on 12 and a half of metoprolol twice a day. And I've just done the dastardly deed of giving them 120 of verapamil. And it's like contraindicated. I don't care what they say. Look, I wrote the textbook. I don't need some pharmaceutical gizmo telling me it's contraindicated when I know it's not.
I
But you do have to
love
use
a
common
soundbite.
sense. You have to understand
Yeah,
every patient is a new patient. There's no one size fits all. This is really complicated stuff. What are your principles of therapy for AFib? You have to prevent a stroke, you have to prevent heart failure. Those are really critical. And you have to make a patient have a better quality of life. No matter how you want to, we went through a whole bunch of ways to do that, but that does not mean while you're doing things that you make them miserable. Because I will tell you what they do. They stop
totally.
the drugs. They just stop them. And there was this concept, and you may have been taught this, that you get them on the drugs and then you put them on a treadmill and you see what their rate is when they're exercising. Listen, I live in Indiana. There's a lot of my patients whose greatest exercise during the day is walking to the refrigerator. So, I'm not going to put them on a treadmill and try to control their heart rate on a treadmill, and then the rest of the day they're going 40 beats a minute. So I am a real simple guy with this. I give them a monitor to wear, and I start it on my regimen, and I tell them do whatever you do in your life. Just be yourself. And I get the strips back and I go right where you're at. You're trying to keep the rate somewhere between 60 and 80, as a mean rate during the day without a lot of hours with they're rolling over 100 beats a minute. And so you just look at the printouts and you see what the rates are. Don't make them slow on a treadmill when they never exercise. So just control them in their own environment is the easiest way to do it.